The top 3 sexual issues after menopause is 1, lack of interest. The second is lack of lubrication or lack of arousal. And then the third is usually discomfort with intercourse. Prior to menopause, we have estrogen in our body, and once menopause occurs, our estrogen levels drop to a very low level. And all of the tissue in the vagina, the mucosa, the musculature of the vagina has estrogen receptors in it. And so once the estrogen is gone, the tissue starts to thin. The skin actually, not only does it get dry, it dries, but it actually thins. And also some of the structures around the vagina that help control the muscular tone of the vagina will actually become weaker. So for example, the urethral sphincter that helps control our bladder, but also our ability to tighten the vagina, which can also cause, people like that during intercourse, if they can tighten their vagina and they feel more of their partner, that ability declines as well. So I think any symptom in your body that persists for more than a month that's unusual to you warrants some discussion with a physician. And then the physician can decide, does your problem warrant some testing to make sure something else isn't going on? Or, do they blanket it into something like, oh, you're just old, or you're just going through menopause. So like I said, is that, and even if you are just old, or if you're just going through menopause, there are things we can do to make you feel better. So for example, I'm a gynecologist, so the main thing I deal with is the hormonal changes that women go through. And I do believe that hormones help women. I'm not afraid to prescribe them. I give people the facts. I tell them what their risks are. And I'm always like, this can be temporary. We can help you for 6 months, for a year, get through the transition so that you feel like yourself again. I have found that the women who are open to trying hormones, some form of hormone therapy, are much happier women. The 3 things I think women need to know to have great sex after menopause is 1, do things to make yourself feel good. Take care of yourself, exercise, get outside, do things that make you feel good. Talk to your doctor. Talk to them about the specific symptoms that you're having. Are you having sleep problems? Are you having hot flashes and night sweats? You may be a person who could benefit from a short-term period of hormone replacement therapy, or you may benefit just from having a local treatment in your vagina. And as far as for your partner and your relationships as you move into your older years, is just communicate with your partner, let them know how you're feeling, and I think that's what will help make great sex.